The UN agencies say millions of people across Asia lack access to basic health care, quality education, and nutritional security despite the region's rapid economic rise. A new philanthropic partnership is aiming to shift that narrative. Let's cross over now to Ilakia Silvaraji. She is coming to us live from Ecosperity Week here in Singapore. Ella, what do you have for us?
That's right, Julie. It's a key regional collaboration that has been inked between the Gates Foundation and the Tanoto Foundation. It's really to address some of Asia's most pressing development challenges. It was announced yesterday at the Philanthropy Asia Summit that's really part of Ecosperity Week. And I spoke to Tanoto Foundation's Board of Trustee Belinda, who shared more about the foundation's partnership with the Indonesian government that started some 8 years ago, and one that saw childhood stunting rate go down from 31%, that's 1 in 3, to now 21%.
World Bank actually gave Indonesia a big $300 million loan. But it's not about the innovation in the actual services being delivered. All the solutions are known, right? How do you support, breastfeeding mothers? How do you support pregnant mothers? How do you support access to clean water and sanitation? All the solutions are known, but it's a matter of innovation in terms of the service delivery, and then innovation in, what President Taman earlier said about organizing. And that's what we did to bring down the stunting rate from 31% to 21%. There was a big program, it's called INE, Infant Nutrition Early Years, and it's about giving the agency to the local government to deliver the programs, because Indonesia is so diverse. 17,000 islands, 300 over districts. It's really important that the ownership is given to the local government and then also to the local community health workers.
Well, despite the economic growth, access to healthcare in Indonesia still remains unequal, especially when reaching rural areas. We're talking about the many cities and counties and districts that you've just mentioned a while ago. What kind of solutions are really proving to be the most effective in closing this gap?
We're very excited. One of the partnerships that we have with the Ministry of Health and the coordinating ministry is to get this transforming data, basically getting one source of data, digitizing the information that's available out there so that Pak Menko calls it precision policy, making sure that there are lots of programs out there. The government has a huge budget, whether it's in health, whether it's in education, whether it's in social affairs, but making sure that it gets to the target, right? That's the challenge in a country that's decentralized like Indonesia, and that's what we're very excited about supporting.
Well, Indonesia is really having and seeing growing momentum in terms of philanthropy. And really, how can global and regional foundations like yours support the ecosystem without overshadowing it?
For us, we think of it in two ways. One is building blocks. And what do I mean by building blocks? So providing data, landscape map of what's already happening out there, tools on how to monitor, just technical things, including building blocks. But the other thing is also creating platforms, right? A lot of people want to give, but they don't know how. And they ask. So it's really important, like bigger foundations, whether global or regional, to come together and create those platforms for other funders to come in. We're hoping that this partnership with Gates will not stop there, but will attract more funding into the early years and to create better outcomes for mothers and children in Indonesia and Asia at large.
No, absolutely. And how do you ensure that the results and the impact that you will be creating together with the Gates Foundation, for example, is sustained?
First of all, I think the most important thing to get sustainable impact is to work with government. I think it's a very big mindset shift for a lot of family foundations, or a lot of family businesses in Asia, because usually, it started with maybe charity or check writing, but to move to catalytic impact or catalytic philanthropy, you really have to work with the government, and the ownership is with the government. It's not with us, because philanthropy funding in Indonesia, it's globally it's only 0.5%, but in Indonesia it's 0.5% of the government budget, so it's even smaller. So it's really important to work with the government to make sure that it's sustainable.
Well, as Belinda mentioned, Asia is tackling persistent gaps in health and education, particularly mothers and more. And we have Hari Menon, who is from the Gates Foundation. I spoke to him further to understand what they will be doing in terms of Southeast Asia here.
In this part of the world, when I say this part of the world, I'm saying the ASEAN region, Southeast Asia, our focus has largely been on health, nutrition, and the financial inclusion work that we've been supporting. And increasingly, there's a focus on digital public infrastructure. So those are the areas on which we've been working sectorally. In health, it's maternal and child health and infectious diseases. The region has a focus on pandemic preparedness. So again, looking at ways that we can partner with governments, philanthropy, with the local research ecosystem. We've got a little bit of work going on agriculture, which could potentially expand, particularly as we look at the impacts of climate change and making sure that countries have food security in the face of climate change. The financial inclusion and digital public infrastructure work is really around the adoption of technology and seeing how that can lead to more effective, efficient delivery of services to people that need them the most. And finally, we are looking at ways to engage with the growing philanthropy ecosystem in the region. We do believe, philanthropy has a role to catalyze catalyze innovation and take on risk on behalf of governments and societies. And so we are quite enthused by the growth in philanthropy. Yeah, so those are the areas that we're working on.
Absolutely. Gates kind of confirmed that there will be a new office here in Singapore. So perhaps you could let us know what the focus will be for the Gates Foundation here in Singapore, and why Singapore?
So we're very glad, to have received an invitation from the Economic Development Board to establish an office here. And we're really looking at, Singapore's role as a hub for the region, and not just for the ASEAN region, but even the links Singapore has to South Asia. So we see Singapore as a hub for innovation. We see Singapore as a hub for philanthropy, and we see Singapore as a hub for learning, diffusion, knowledge exchange. Now, all of those are strengths that Singapore has established over the last several decades, and we see a unique confluence of these capabilities in the service of health and development progress in the region. So we are looking at a regional hub based in Singapore to help us cover multiple countries, and the partnerships, like I said, with the research ecosystem, with philanthropy, and with the knowledge ecosystem here, we think can have multiplicative and amplificatory impact across the country. So we're very happy to be based here. We are working through the details. We hope to have people on the ground in the next several months. This will be a very important addition to our global footprint.
Indonesia is a key partner of the Gates Foundation, and specifically in tackling childhood stunting and malnutrition. Perhaps you could let us know what are the most pressing challenges currently that the country is facing, and what are you guys doing to tackle that?
In Indonesia, 10 plus years ago, they decided to create a national mission to focus on childhood stunting, and that's actually already had impressive progress. Really a matter of scaling and maintaining emphasis, and it's good to see that even through the political transition, their focus on childhood nutrition has remained a high priority. So we think strengthening primary care, improving detection of children that are undernourished, and then getting them the proven set of interventions in a cost-effective manner, those are the priorities which the government seems to be driving. And we're looking at ways to be a catalytic partner for that going forward as well.